Dr. Travis Rose here from Peak Form Health Center, and we're here today with a patient with some generalized low back pain. And he's been having low back pain with long periods of sitting, long car rides, etc., and also after heavy bouts of strength training, squats, Olympic lifting, etc. So after evaluation, we found that he has a little bit of an anterior tilt in his pelvis and he's getting excessive compression into his lower back. So to address the joints, what we're going to do is hook him up to this table here. We have one strap into his lower back and we have another strap onto his legs. And this is going to help keep his body in the right position, and this lower half of the table is going to stretch out to decompress, open up those joints so we could take it through some range of motion, stretch out the deep muscles, the deep ligaments, as well as the joints themselves. So what this looks like for demonstration here is I'm going to start by stretching out the table here. So as you can see, the bottom half's opening up. Kind of takes the slack out a little bit, but now we're starting to see this strap grab onto the lower back, and we're starting to get a good stretch into his back there. So you feel a little bit of a pull in the back?
Yeah.
Okay, no pain or anything?
Nope.
Okay, so when we do this, we want it to be relatively pain-free. We don't want to have any pain shooting down the leg, any radiculopathy or sciatic symptoms. A little bit of low back discomfort's okay, but you should just feel sort of a general stretch when we're doing this type of treatment. So now what I'm going to do is actually take him through some range of motion here. So I'm going to support the lower back, and now I'm just going to gently push down. And now we're going to repeat that. So each time I'm just supporting the back with the strap. I'm feeling the pull in his back. Do you feel a good stretch when I'm doing this?
Yep.
Okay. No pain?
Nope.
Okay. And we're going to do that through the levels where we found the most tension, the most compression in his back. Now his back pain is relatively generalized and just kind of central through the mid back or the lower part of the back here. If a patient has pain on one side of the back or the other, this table also bends into different directions to where we can address one side more than the other. In some cases that can be very, very helpful. But for his lower back, we just need to do a few rounds of this stretch into the joints to loosen up, again, the joints, the muscles, and the connective tissues. Okay.